Memory Foam Mattress Headquarters.
If you are dealing with chronic pain, no doubt you're looking for ways to make yourself feel better. Sometimes that journey can be very frustrating because you want answers and you want them quickly. Dr. Shawn Jones is on the show with us this morning with Chattanooga Wellness, and he says depending on what you're dealing with, if it's a neuropathy issue, he would love to help you. So good to see you.
Neuropathy is so misunderstood. There's so many people are suffering from it. The number one cause nowadays is chemotherapy. If you survive cancer, now you've got neuropathy. They know it's going to cause neuropathy, so you want to be aware of that. The second most common cause is surgery. Back, knee, hip, neck surgery can cause neuropathy in the hands or the feet as a secondary thing. The third most common cause is what we think of, which is diabetes. The high blood sugar will cause neuropathy to develop too. And the fourth one is what they call idiopathic, meaning something caused but wasn't the normal three. And it could be your work environment or other things. It's like I say, it's the first rule of Italian driving. What's behind you doesn't matter. It's going forward that counts, right? Speed forwards.
Right.
It doesn't matter. Let's find out what's going on, how bad it is, and let's get it fixed. Let's get you feeling better.
So there are two different approaches here and two different things to be discussed. So one is the how do we fix what is.
Right.
The other is what's causing what is.
Yeah, well.
Do you address both?
Oh yeah, we take a thorough history first, and I go through and I do an exam. And so for $49, you can come in, we do a thorough history, we do a full examination, a neuropathy examination on 8 different sensations to see what sensations you've lost or not lost. That determines how bad it is. I also do a full muscle evaluation. If it's the feet, I start at the hips and go all the way down to the tips of your toes and check all the muscles. Anything that's weak, I use my little pocket laser and I'll reset it and make it strong that visit. And we do a full treatment with laser therapy, vibration therapy, massage chair to work the feet and calves and work fluid back towards the heart. And of course, extremity adjustments with the chiropractic care to the feet or hands, and then also on the spine, if your spine can handle, if you haven't had too many surgeries and stuff.
I might have used the wrong word because I used the phrase chronic pain. Well, I guess, is neuropathy painful, or do you first notice it as just a loss of feeling? Is it a tingling?
It's all different things. It's a good question because I had a new patient start yesterday. He's doing the first treatment. He felt tremendously better. And his came on just in 1 year. Now, that's not a good sign when it goes from barely feeling it to he has very little sensation at all in just 1 year. So, and he doesn't have any in 1 year. Yeah, it went downhill fast on him to the point where he's starting to have falls. And then when you start to have falls, the problem is you're going to injure yourself with other injuries. So we want to try to prevent it, get your balance back. Right. And when we test you, it depends what level of care you need, depends on where you come in on your sensation level. So if you've lost 50% or less, we can just do in-office treatment only. You don't need to take any equipment home with you. And if you've got between 50 and 75%, we need to take usually the red light therapy home. And if you've lost more than 75% of your sensation, you're going to have balance issues. We send what's called a rebuilder home with you to train the nerves to function and rebuild you. And so that way, when you come back on your second visit, we know where you're at, what kind of care you need. And what we use in the office, you should not be able to do at home, right? Because it's too expensive. What we send home, you should be able to do at home. The problem is other people in town that say they treat neuropathy, what we give you to take home is what they're treating in their office with. I'm like, why would I treat you with what I can just send home with you? I want patients to be actively involved, to get in and do their own care at home a little bit. It's easy. 20 minutes twice a day for the feet, using the red light therapy, and it keeps it going. Okay,
but then you were telling me that some people either don't want to do it or it's not as effective. I'm not sure which it is. And so they turn to stem cells.
Yeah, what happens is we have 3 types of patients. Those that follow what I tell them to do, those that follow what I tell them to do, but they fall off the wagon a little bit, but they still get them there, it takes longer. Then we have those people that do the program for a couple weeks and then not do it. Look, I don't want somebody to spend money if they're not going to do the program, okay? We can do stem cell therapy, or regenerative medicine is the proper term nowadays. And so what we can do is, if you're not going to take responsibility, then we can do injections, have our medical team come in and inject in the feet or in the hands stem cells that have cytokines, of course stem cells, exosomes, and Wharton's jelly. And what that does, it keeps those healing factors right there and will heal the neuropathy without doing it. Now, I'd rather do it the way we know works 98% of the time. We have a 98% success rate. But we do that, occasionally we'll do that because people just are honest with me. They say, look, I'm not going to treat myself at home when it's pretty severe. Let's do some stem cells also.
Are the stem cells the patient's stem cells?
No. That's PRP. That's bottom of the barrel. We use fetal cells that are from C-sections that are donated from vetted labs by the FDA. Same labs that Walter Reed Hospital uses to treat our vets is the same labs we use. We get the product from them, we can inject it, and they have a new product instead of PRP, which is not concentrated. It's just straight out amniotic fluid, but it's a lot better and stronger than PRP. And so if somebody wants PRP, we'll use that instead of the more expensive concentrated products.
Okay.
And so we have different programs with that to help with neuropathy and all kind of problems. problems, knee pain, shoulder pain, chronic problems. Let's avoid a replacement of a joint if we can.
So when they come to you, if they have a neuropathy issue, when they come to you, you'll do your own assessment, but then you try to speed things up by sending this equipment of varying types, depending on their situation, home with them to do. Then they come back into the office every so often to get your end treatment.
Exactly. I tell patients, it's like on Johnny Carson. I used to always watch Carson before I'd go study at nighttime. And he had that guy come on a couple times a year that used to spin the plates on Channel 3.
Oh, yeah.
It was Johnny Carson back home. And I thought, this is hokey. And after 30 seconds, I'm going, hurry, hurry, spin those plates. But it taught me something. He had 8 plates spinning perfectly, and he said, all I got to do is tap it a little bit and keep it going. So every time you get a K-laser treatment or a shockwave treatment, all we got to do is keep it tapped by using home equipment to keep it spinning and keep it moving forwards to get you well. We don't want you in pain. We can get you out of pain, and it's only $49 to come in and get evaluated and see where it's at. And that also includes coming back on the second visit and to go over the results with us.
So here's where you'll find him. He has offices in Chattanooga on East Brainerd Road, in Cleveland on Chambliss Avenue. The best website for this one is shockwavepain.com. The phone numbers on your screen are the correct ones to call.
Yes, ma'am.
Thank you so much.
We look forward to seeing you.
And Shawn, as you know, Dr. Jones, when he's here, loves to share a few humorous comments when he's on the show with us. He likes a good laugh, and so do we. That means it's time for your Dad Joke of the Week.
Your Dad Joke of the Week brought to you by Scenic City Neurotherapy. Everyone deserves a laugh.